With the Purdue medical plans, you have a choice of healthcare providers. When you need care, you can see providers in one of three network options: Tier 1 HealthSync, Tier 2 in-network, or out-of-network. The same types of services are covered in each tier, but your costs will vary based on where you receive care. If your provider is a Tier 1 HealthSync provider, your costs will be lower than if you see a Tier 2 in-network or out-of-network provider. There are many Tier 1 providers throughout Indiana to choose from, all offering high-quality services, including the Center for Healthy Living on all three campuses, plus providers from Franciscan, Lutheran Health, and Ascension St. Vincent. When you receive care under our plan, you first pay a deductible. This is the total amount you pay before the health plan starts paying too. You'll pay a lower deductible if you choose a Tier 1 provider. Once you meet the deductible, you will then only pay a small portion of the costs. The health plan picks up the rest. This is called coinsurance. With HealthSync, you'll pay 10%, and the plan will pay 90%. This means you'll only pay 10 cents in coinsurance for every dollar when you choose a Tier 1 provider. Your coinsurance is at least 2 times more for a Tier 2 provider, and at least 4 times more for an out-of-network provider. And finally, the out-of-pocket maximum is lowest with Tier 1 providers. That's defined exactly how it sounds: the maximum amount you'll have to pay out of pocket annually. The Tier 1 out-of-pocket maximum can be thousands of dollars less depending on your plan. Now that you have the basic knowledge about your health plan expenses, let's take a look at a real-life example to understand how costs are calculated. Let's assume you have single coverage with our standard CDHP plan. Your first appointment of the year is with a specialist. You will pay the full cost since you haven't met your deductible. You find a Tier 1 HealthSync provider, which is great since Tier 1 rates and deductibles are lower. Your visit costs $100. This $100 charge will apply to your Tier 1 HealthSync and Tier 2 in-network deductibles. Your next visit is to a Tier 2 in-network urgent care facility. Again, you'll pay the full cost since you haven't met your deductible. This service costs $215. And even though it's a Tier 2 in-network provider, the $215 applies to both the Tier 1 HealthSync and Tier 2 in-network deductibles. Here's where we are so far. A total of $315 has been applied towards the Tier 1 and Tier 2 deductibles. Throughout the year, you need several labs, prescriptions, and an X-ray. Choosing Tier 1 HealthSync providers, like the Purdue University Student Health Center for labs and imaging procedures, helps you save money. With Tier 1 providers, the cost for these services is $1,950. Let's walk through how much you'll actually pay. For these services, your costs will be split into 2 categories: the amount needed to reach your deductible and the coinsurance amount. You'll pay $1,835 to reach your Tier 1 deductible. This leaves $115 left to pay. Your share of that is only 10%. The plan pays the rest. When you add that to the amount paid to reach your deductible, you'll pay a total of $1,846.50 of the $1,950 cost. Then you've met your Tier 1 deductible for the year. Now, you'll only pay 10% for all future Tier 1 services until your out-of-pocket maximum is reached. Since expenses count towards your Tier 1 and Tier 2 deductibles, let's look at how the cost of services also applies to your Tier 2 deductible. You've now spent $2,161.50 this year, so you're close to meeting your Tier 2 deductible. Your final appointment is for a biopsy. You choose a Tier 2 provider, and the procedure costs $2,450. You will owe $763.50 to meet the Tier 2 deductible. The remaining $1,686.50 will be shared by you and the plan. Your portion is 20%, which is the Tier 2 coinsurance. Your total cost for the $2,450 biopsy is $1,100.80. However, if you had chosen a Tier 1 provider, your cost for the biopsy would have been less than $245. You've now met the Tier 1 and Tier 2 deductibles, and you'll pay coinsurance for future Tier 1 and 2 services until you reach your out-of-pocket maximums. And remember, your preventative care visits are always free of charge. You can find a Tier 1 provider using the Anthem website. When you get to the screen with provider choices, you'll see the tier listed next to each provider's name. One final note: with our health plans, you receive a contribution from Purdue into your Health Savings Account, or HSA, or Health Reimbursement Account, HRA, to use for healthcare expenses. You may also deposit tax-free money in your account to further offset eligible healthcare expenses. You can learn more about HSAs by visiting the Purdue Benefits website. Remember, you have a choice of providers. Who you use and where you go is up to you. But if you're cost-conscious, Tier 1 HealthSync gives you an option to help you save money and better manage your healthcare dollars.